I had my first child at 25 in 1975. When I looked at going to work and paying child care, that was very difficult.
I couldn't find adequate daycare for my children. Financially, we could not make it if I didn't work. So I started looking around, but I couldn't find much.
There was not a lot of quality care around.
In the 70s, moving into the 80s, there were just a lot more women that were going into the workforce.
And those were the women who would go to work, then start a family, then discover how difficult that was because the resources weren't out there to support them. Companies were sort of had to begin to look at what was happening to their employees now that many of them were women, and they discovered that the absence of good care for children was causing them to lose people that they'd spent lots of years and money training.
It became an issue that we would see discussed in the media as a societal issue that we needed to address.
This was when President Reagan was in office, and he felt that the private sector needed to be more involved.
There are more of these things that could be solved by the people themselves.
He charged local communities, the business sector, the private sector, to really step up.
The companies were very willing to support that effort and were helping their employees get good child care.
When Initiatives for Children started,
it was an idea that originated through private sector initiatives.
it began as an information source for parents to come to look for information on where I can find a safe place for my child.
Kathleen Rowland was the director, who was just terrific, and she really had the bigger picture.
My vision was to try to find a way to improve the quality of child care through any means we could, and it just took off.
Initiatives for Children became sort of the central focal point around helping parents find what they needed and for directors to provide what parents were looking for.
Our main goal was to provide a complete listing of the data for all the child care centers.
There was the wall of black books. These black books contained provider profiles, handwritten, listing things like what the ages they care and what kind of things they do with the children.
This is all pre-computers, internet. We didn't have a lot of technology. We had one computer we all used.
We did not have internet. We didn't have Google or Facebook or email.
But it really didn't matter because we were just all in this together, and that's what counted. And it was just a wonderful environment.
One of the things that was happening at the same time was that we were learning so much from what science was telling us about how young children grow and develop.
The most dynamic time of a child's neurological growth is the first 5 years.
If you start kindergarten way behind, their likelihood of being able to close that gap by what happens even with the best teachers is lessened.
If children get a good start, the likelihood of them being successful in school, being successful as human beings is enhanced.
Our job, we thought, would be to help raise the quality of care by doing caregiver training.
One of the things that we chose to do was to do a short film that portrayed what life was like in a family day home.
Initiatives for Children is about helping parents find good child care and teaching caregivers how to provide it.
We used that video to help other registered family home caregivers in the neighborhood to encourage them to come for training.
Because of Initiatives for Children, we were one of the first homes accredited in the state.
At one time, the field was viewed as babysitters.
There was not a sheet of paper that told you, okay, you know, you have to have this or, you know, or that.
While I wanted quality, I wanted high quality, I didn't really know what that looked like. Initiatives changed that.
Well, GHCC came to existence to pool resources together to fund major initiatives that would impact the lives of young children.
People were sort of acting in silos, and everyone would come to the foundations with a project, and it was like no one was talking to each other.
It became clear that when you put the entire philanthropic landscape together in the same room, planning a collaborative project, that it could work.
The particular aspect of this that was attractive to Chuck Bonjean and Makonda Brown O'Connor was the idea of collaboration, and that we could do more working together than we could do individually.
I remember when Initiatives for Children and the Greater Houston Collaborative for Children started working together. Over the course of years, we worked together on a number of different projects related to early care and education that ultimately ended in the merger.
It was so evident that both groups were doing the same thing, both groups meaning Initiatives for Children and the Greater Houston Collaborative for Children. And we realized how powerful it would be if we joined forces.
It brought under one roof a continuum of services related to early care and education, and that being the Collaborative for Children that was created.
When you combine quality child care with increased strength from family support and access to health care, putting those three elements together, you're going to raise the odds of that child's success in life dramatically.
Today is my first day at kindergarten.
I think because he had his foundation, I think it's a lot easier. It's just a happy moment.
I think one of the things that was exciting about College Bound from Birth was it gave us an opportunity to facilitate a new approach to really helping children get off to a great start.
When I was looking for childcare, to be honest, I did a late-night Google search for find childcare in Houston and noticed Collaborative for Children on the search. It's really just looking for centers in my area. So when I used it in 2007, it did just that. When I returned to the Collaborative website in 2010, when I needed to change childcare centers, it was so different. The same helpful tool of finding centers, but it had also added a quality indicator on the STAR system where I could see where different centers ranked on things that were nationally recognized as high quality standards for young children, and gave me another tool in making my decision for childcare for my children.
Our community is certainly much further down the road because Collaborative came in and set a standard.
Collaborative for Children is really a bridge between parents and childcare providers. Without the service of Collaborative for Children, it would be difficult for parents to find all the childcare options that are available in their community. Knowing that my children are in a safe, educational place definitely helps me to be a productive, better employee.
There is no question that a lot of progress has been made over the last 25 years. Both mom and dad are in the workforce, and so we know young children are in the care of other adults. We have to be committed as a community to make sure that all children have the opportunity to get off to a good start with a strong foundation. The only thing that is limiting us is the ability to have the resources that we need to do more for the families and the early education programs in our community.
And help children like me, and me, and me, and me, and